Certified by the American Board of Plastic Surgery, is considered one of South Florida's finest plastic surgeons with 30 years of experience. As a privilege of aging, you pay for that with wrinkles, sagging, and wrinkles in your skin. Modern plastic surgery procedures allow you to look better and feel better about yourself. His office is located in Coral Springs and serves patients from all of South Florida and beyond. When people are taking care of their health through diet and exercise, yet are still unhappy with their appearance, a consultation with Dr. Levins can address both facial and body concerns. Through various sculpting procedures, you can improve your appearance from head to toe. If you are considering plastic surgery, you should do your homework to carefully research your choice of surgeons. While the majority of plastic surgery patients are women, plenty of men take advantage of various offerings, and Dr. Levins has a lot of experience with male-specific procedures for the face and body. Contact Dr. David Levins' office today for a free consultation at 954-752-1020. That's 954-752-1020.
You are listening to the Ask the Experts show with host Steve-O. We will be right back with more experts in the field of legal, health, financial, and home improvement. Join us every Thursday from 5 to 6 p.m. Now, get ready for more Ask the Experts.
And we are back, and I am joined with Dr. David Levins, one of the finest plastic surgeons in South Florida, who pretty much does almost everything from breasts to butts, from faces. You know, what else do you do, Dr. Levins?
Well, I do the broad range of general plastic surgery. Probably breast is my number one procedure, but I do a lot of facial rejuvenation. And so facial rejuvenation is something that can be as young as 30 or 40 years old, and then, of course, up to 50, 60, 70, more with facelift surgery. Usually younger, it's non-invasive or minimally invasive procedures like injections, skin care.
Like what type
laser.
of injections?
Well, the categories injections there are two types of injections. One type of injection is a filler, and the other type of injection is a toxin. So Botox is the name of the most common toxin that we all know about. There's also something called Dysport and Xeomin. They're all very similar.
Xeomin's not one I hear a lot. Can you explain?
Well, Xeomin's a little less common, but one good thing about Xeomin is you don't have to refrigerate it, and it also doesn't have proteins. It doesn't have as many proteins around it. So Xeomin may be helpful for someone that's had a problem, maybe some reaction with Botox. Dysport is the second most common after Botox.
Do they metabolize slower, or is it?
They all have their little bit of different characteristics, and they all are useful for treating lines, usually on the upper face, the so-called frown lines or 11 lines, the forehead crossing lines, and then the crow's feet lines. So generally for the upper face, those are the injections.
Yeah.
Lasts about 3 to 6 months, very quick, takes a few days to work, and the fillers are used generally more for the lower face. So the whole idea with aging, well, of course, for a younger woman that just wants lip enhancement, a filler such as Restylane or Juvederm, it's a hyaluronic acid, very safe, and you can plump up the lip and see it right away, or you can fill in the so-called laugh lines.
Don't you love instant results?
Instant results are great.
Women love that.
Well, instant results are great, but everyone says, oh, you mean I have to repeat it, though? That's the thing. And so the point is that it's kind of good and bad. It's good for us because people keep coming back.
Right.
But it's also just like, it's an annuity, but it's something you have to keep up with. It's like going to the gym. You can't just go to the gym once and have great results. You can't just eat well once and have great results. So if you want to maintain your skin, maintain your appearance, then it's best to keep up those results.
You got to service your car, you got to service your body, right?
Exactly. So what I'll say also is that with that, people say, oh, if I heard if I do it once, I can't stop, or I have to keep doing it. The truth is you get used to it. You enjoy the results, and so you want to come back.
And you're preventing.
You're preventing potential things in the future. Exactly right. I mean, you can't stop the aging process, but you can kind of maybe slow down the effects of aging on your face for sure.
And why not do it? Right?
Why not? Why not?
So the difference again between how did you say?
The one's a filler and one's a toxin. I call them toxins.
Toxin.
It's a neurotoxin.
So all of the three that you mentioned before, the Dysport, is that also considered a toxin?
So Botox is a toxin, Dysport is a toxin, and Xeomin. There's actually something new called Juvo. Every manufacturer wants to have one because Botox, which is made by Allergan, the big company that makes eye lenses. They also make breast implants. It's a huge multi-billion-dollar business, and they have direct-to-consumer advertising. So many of the other companies have tried to, they've gotten into it. So there's a company called Galderma. They make Dysport. Then there's a company called MERS Aesthetics.
Yeah.
So they make a filler and they make Xeomin. And now there's a new company called Juvo. But I mostly use Botox and Dysport.
Yeah.
And-
Do you find, I'm sorry, I didn't mean to cut you
That's
off.
okay.
Do you find that people, like, after a while, they build up a tolerance to Botox and they have to switch to Dysport?
Well, actually, what happens with that is that that's what I was mentioning, Xeomin. One of the key factors about Xeomin is that it's a toxin that does not have as many proteins around it. And so there's a theory that the proteins that are around the toxin may create some sort of immunity, and then that you might have a tolerance to it. So Xeomin is a good option for people that maybe it's not working for them anymore. Generally, it continues to work. It's just a matter of you get used to the results and you want to keep going back. And some people come as early as 2 or 3 months. Some people wait 4 to 6 months. And then there are financial considerations, other considerations. It's purely elective. It's cosmetic. You don't have to do it. But certainly we like to be able to treat people, and it's a very satisfying. People feel much better. They look rested. They don't look as angry. And the things that they say is like that they may not like the totally frozen look because they want to have some expression.
Yes.
But like they can't look angry at their kids, and maybe they want to look angry at kids and whatever. So there's all kinds of different considerations. We try to individualize it for all patients.
So you're good at keeping it moderate if they're looking for a moderate experience?
I try to individualize it for the patient. I also take a lot of photographs, very important, because digital photography is so easy. So we take photographs, we have a screen in the room, and we show the patients what they look like. And then when they come back for their follow-up, they say, oh, I don't think it really worked. And we could say, hey, look at that result. And so it's very important to monitor that, because there can be some asymmetries. One side can be different than the other.
Yeah.
One side of the face, it's very, very common for people to have asymmetries. They don't like to look at their pictures. No one likes to look at their pictures, but it's important to document
eyebrows hanging higher
Absolutely. And sometimes I can create that, but I can fix it also. They come back and we see that one is a little different, then we can make a change and make an adjustment.
Worst case scenario is it's over in 3 to 4 months.
Exactly. That's exactly right. That's what I say.
It's not like permanent plastic surgery. So we've talked about what to do with kind of the younger population.
Correct.
What would you do for someone who's hitting maybe 50s, 60s, when they're needing a little more?
So the older, the truth is that fillers are very good for adding volume to the cheeks, adding volume here. And
do you have a favorite for the cheeks?
Well, I like a filler that's a thicker filler that maybe lasts a little bit longer, 6 to 8 months. So there's something called Voluma. There's something called Restylane Lift. So they have great names, but they're basically thicker fillers. They have something that's called a G prime, a higher G prime. So it's a more cohesive. So it has the potential to really build up. It's injected deeply over the bone. It adds volume. And the whole idea is to try to take the face, which with aging becomes a little more square as things start to go down, and then try to make a sort of upside down egg appearance where you're adding volume up here and having less volume down here.
So by bringing the volume up here, you're less noticeable with
That's
what
exactly
you're losing
right.
around the
That's
chin?
100% correct. And some of the loose skin, some of the jowling can be lifted by that. But there's a limit to that. So therefore, when you get to be late 50s, 60, maybe some weight loss, looseness here, jowls here, then you're really better off with a facelift, which is a surgical procedure, and definitely much more definitive, more long-lasting, but of course more downtime. It's an invasive procedure, but still a very good option for patients in that age group.
I've heard of the mini lift. Do you do a mini lift versus a full-blown facelift?
This is really good, because I'm glad you're asking this question. I hear people ask about this. Am I having a full facelift or half a facelift or whatever? So when you talk about a facelift, classic facelift is incisions that go in front of the ear, back behind the ear, and then here, because you're doing the lower face and the neck.
Yeah.
So a full facelift doesn't really do the eyes and the brow. But if you need to have work on your eyes or work on your brow, then that's a full facelift plus eyes and brow. Now a mini lift, or so-called cheek lift, is really just working on the cheek itself and doesn't get the neck.
Oh, okay.
So that's a shorter incision in the ear, in front of the ear, not going back behind, or you can actually go through the lower eyelid and sometimes lift up part of the cheek. So that would be more of a mini lift. There are also all kinds of gimmicky things that have gone on with so-called thread lifts.
Yeah, what do you think about that?
Lifts, weekend facelifts. Well, the problem with those is that you're not really mobilizing the tissue enough. And so if you're not mobilizing the tissue and getting good fixation, the results are just not going to be as dramatic or long-lasting.
Yeah.
So I don't tend to do those procedures. Those procedures tend to be done in more of like clinics, high volume, an hour or
Spas.
two, spas. No, absolutely. Wide awake. I mean, I like my patient to be sedated or asleep in an operating room, a surgeon.
Yeah.
And a classic, typical facelift, you're talking 2, 3, 4 hours. One of these things, it's done in 30 minutes or an hour. There's just no way you can get the same type of impact and the same longevity. So that I'm a little suspicious about that, but I do have patients. I mean, I have colleagues that kind of like name their own facelift too, but a facelift is a facelift.
Yeah.
You tried not to reinvent the wheel, but
Yeah.
there's some people that do it for more gimmicky and
Temporary,
Yeah.
very
Yeah.
temporary results.
yes.
What about, you mentioned going under the eye. Does that leave a big scar? Because,
Well,
women are worried about the
That
scarring.
actually is a very tricky procedure. When the eye lift is done, there's an incision right under the eye,
Mm-hmm.
and then there's an incision usually on the upper lid. And if you extend that a little bit more and you go deeper down, you can get some deep stitches in to lift up the cheek, and that's a so-called cheek lift. But there can be issues with the lid coming down or
little
having
drooping.
drooping in positions like that. So it has to be done. It's a technically
Yeah.
precise procedure, and it's
But
a
the
good
scarring's
procedure.
tiny,
The
you don't
scarring's
see
not
it?
too bad because it's usually what's just under the eyelid, under the lash line, and
Yeah.
then sometimes a little extension down.
Now, have you ever done a surgery where you put the what do you call it, the incisions in the scalp?
Okay, well, the scalp incisions classically were done for something called a coronal brow lift.
Okay.
A coronal brow lift is when someone needs to have their brow brought up, and so you can make that incision at the hairline, or you can make it inside the hairline, and then it looks kind of gory where you peel the skin down.
Yeah.
Of course, the patient's asleep in the operating room. It's a big procedure, and then you pull it back up. The problem with that is that you can leave a big scar inside the hair, and if the hair thins, it could be visible. It also can cause some numbness, and it takes a longer time to recover. So the alternative to that is something called an endoscopic brow lift. An endoscopic brow lift, similar to like laparoscopic surgery or arthroscopic surgery, is using a small incision, creating a visual tunnel. That's exactly right. And then you pass an instrument that's connected to a scope so you can see what you're doing. You create a visual field, and you don't have to have as long an incision. So that's the type of brow lift that I do. It's
Now,
called
that's
endoscopic.
very neat.
Yes.
Because it
yes.
sounds minimally invasive, and that you're
minimally
pretty just
invasive, smaller incision, and get a lot accomplished with small
precise.
incision. More precise, yes.
So how many hours does that procedure take?
Well, that procedure takes about 2.5 hours just for that.
Yeah.
So if you're going to do that and a facelift, you could be talking about 5 or 6 hours altogether.
And so, particularly when you're dealing with an older population, is there anything like I'm sure you recommend that they get some sort of testing before they have the procedure because they're going to be undergoing anesthesia?
Absolutely. This is a purely elective cosmetic surgery. No one needs to have cosmetic surgery. I'd love to have people do cosmetic surgery.
Sure.
But risk avoidance or risk aversion is like my number one, and safety is my number one priority.
Yeah.
So, I mean, I do have patients that come in that are, it's pretty incredible. You know, physiologically, you can have a 70-year-old that is a lot healthier than a 50-year-old.
Yeah.
And you can have a 90-year-old, but then you have some 50-year-olds that are just not that healthy. So, I mean, if they're smokers, heart disease, diabetes, kidney disease, then they definitely have to get what's called a medical clearance.
Okay.
So they have to see their medical doctor, and their medical doctor has to run some tests and make sure that they're able to tolerate this kind of procedure, because it doesn't make sense to do it if they're going to have some sort of a fatal event, look great, and then
then die on the
There's a
table.
joke for that, actually.
What's the joke?
You wanna hear the joke?
I want to hear the joke.
Okay. So the joke is that there's a woman that she was very fortunate because she was able to wait. I have to get this joke right. So she had an incident, a health scare,
Yeah.
and God promised her that she prayed to God, please, I'll survive, whatever, and He promised her that she'll live forever. She'll live a really long time.
Okay.
So she says, this is great, so I'm going to go and have a facelift. So she goes and has a facelift, and she looks amazing. She looks great. And she walks out onto the street, and she goes to cross the street, and this is like a few days after facelift, she gets hit by a car and dies instantly. And she goes to heaven, and she says, wait a second, God, you said that I was going to live forever. He goes, well, you looked so great, I didn't recognize you.
I think I've heard that one before, but
I
it's
should
been
have
a
blew it.
while.
I'm not that good with jokes. But,
Well, you reminded me of a story, too, of, I don't know if you know that actor Nick Cannon. His mother died because they did, like, multiple procedures on her at the same time.
Yes,
And I guess she
yes.
wasn't maybe a healthy
Physically
candidate.
fit, yes.
Yeah. Like, what do you recommend for the number of procedures that you're going to do on a patient?
Oh, in one day?
Even if
Well,
they're in their 30s versus.
No. That's a really good question. So it's a risk stratification. I mean, there's something called medical clearance. And really, a medical doctor can't say, oh my God, this person is perfect, but they can say that their risk is generally low, and you can use your judgment as a doctor, even though I'm a plastic surgeon, not a cardiologist or internist. And so someone says, look, I want to do this, this, and this. I say, you know what? Let's do this procedure. What's your number one priority? See how you do with that, and you could always do the other one later. So it doesn't really make sense. You're prolonging the surgery, you're increasing the risk. It's fatiguing for the patient and them physiologically. It's fatiguing for me as well. So I would rather stage certain procedures.
So there are certain times you do 2 procedures.
That's correct.
If they're healthy.
Like do their face and then do the eyes another time.
Yeah.
Or for the body, I mean, for sure. We're talking mostly face now. But with the body, I mean, we talked about massive weight loss the last time. Someone loses a massive amount of weight, they have a problem with their neck, their arms, their breasts,
You bet.
their stomach, their thighs. There's no way you can do that all at once. It just doesn't make sense.
Yeah, and they could have other issues, like you're saying, that you get them tested for, like high cholesterol and
Absolutely.
and cardiac
Absolutely.
issues.
Yes, absolutely.
Give folks your phone number and your website.
Okay, our phone number is 954-752-1020, and our website is www.drlevens.com, drlevens.com.
And I think it's really important for folks to go on your website or your Instagram and look at your photos, because before and after speaks volumes about the kind of work that you do.
Yes.
And of
We
course,
just posted a picture of a blepharoplasty today.
okay.
75-year-old woman. She's thrilled. She looks great. And we just posted her picture today. She was very excited. She's gotten all kinds of compliments. She's really happy. And,
Yeah, pictures say a lot.
Yes,
It
yes.
definitely tells of the kind of surgeon, and then, of course, meeting you in person and getting to
Yes,
know you.
yes.
Well, we're going to come back after the short commercial break, but I'd like to encourage callers to call in if you have a question for Dr. Levens. The phone number is 1-888-565-1470, and we'll be back after the short break.
Great.
Dr. David Levens, certified by the American Board of Plastic Surgery, is considered one of South Florida's finest plastic surgeons with 30 years of experience. As a privilege of aging, you pay for that with wrinkles, sagging, and wrinkles in your skin. Modern plastic surgery procedures allow you to look better and feel better about yourself. His office is located in Coral Springs and serves patients from all of South Florida and beyond. When people are taking care of their health through diet and exercise, yet are still unhappy with their appearance, a consultation with Dr. Levens can address both facial and body concerns. Through various sculpting procedures, you can improve your appearance from head to toe. If you are considering plastic surgery, you should do your homework to carefully research your choice of surgeons. While the majority of plastic surgery patients are women, plenty of men take advantage of various offerings, and Dr. Levens has a lot of experience with male-specific procedures for the face and body. Contact Dr. David Levens' office today for a free consultation at 954-752-1020. That's 954-752-1020.
And we are back with Dr. Levens. Dr. Levens, we left off talking about kind of more intense surgical procedures that we could do as we age. And now let's talk a little bit about like maybe some ways to help our skin that are also non-invasive, but maybe involve like supplements or something that we can do.
Sure. Well, I think that we talked about the gym and how important it is to have a good diet and to exercise regularly. It's important to eat well. And so, limiting cigarette smoking, limiting alcohol, having good, vitamins and a good healthy meal. And then what we do in our office is we have a medical spa. So we have an excellent licensed medical esthetician, and she provides all the services that I don't provide. So I do the injections, and then she does the complementary treatments for the skin. It's kind of like analogous to when you make your bed and you kind of pull the sheet. Surgically, you can pull the sheet, but getting rid of the fine lines is what she does. So in terms of getting rid of the fine lines, there's something called microneedling. Microneedling is a treatment that involves making tiny little punctures in the skin, and it stimulates collagen growth.
So wound and repair?
It's exactly right.
Yeah.
Very smart. And we add something called PRP, which is like the great miracle, platelet-rich plasma. So we draw the patient's blood, spin it down, take their platelet-rich plasma and add it to the microneedling, and it tends to speed up the healing and get a better result. These are procedures that are not, they're not non-invasive, but they're minimally invasive. A little topical anesthetic, a few days of peeling, and that's it. And it can be a very nice adjunct to doing the facelift. So we're talking about facelifts, but you can't get rid of all the little things, so
Yeah.
then you do the microneedling either before, after, a series of that. In addition to microneedling, there
Can
are...
I-
oh, you sure.
Can I just ask one thing?
Yes.
So if you did the facelift, could you,
You have a
also...
friend, right?
Right, yeah, I do. I'll get to myself later.
Yeah,
But like, can you also do CO2 lasering?
Okay, well, what I was going to tell you. Essentially, they're all different ways to wound the skin. Okay, a sunburn wounds the skin. That's a superficial burn. It's a first-degree burn. And then you can wound the skin with a chemical. You can wound the skin with microneedling. You can wound the skin with laser. You can wound the skin with dermabrasion. So these are all different techniques to very carefully and in a controlled fashion wound the epidermis and then a portion of the dermis. Now, the skin regenerates from the dermis. There are little epithelial cells, or the epidermis goes down into the hair follicles and the oil glands down into the dermis, which is right underneath. And as long as you preserve a good amount of dermis, then you can get a nice new layer of fresh, healthy skin. So it all depends on the downtime. You want something that's going to be a day or two downtime, it's going to be an extremely superficial treatment, and you may not see that dramatic result.
That's the
So
problem.
usually with that, you do a series. Someone says, look, I can't be out of work for more than a day or two. So you say, you know what, we're going to do this 3 or 5 times.
I can't
once
be
a
hiding
month.
like the Elephant Man.
Right, exactly. Once a month, once every 6 weeks, or whatever. Now, a CO2 laser that you mentioned, that's a very, very dramatic carbon dioxide laser. It's very attracted to water in the skin. And so depending on how deep you do that, really there's something called a fully ablative CO2 laser that I rarely do anymore. So the more common one is something called fractional. And the fractional involves little tiny channels that are made, and it preserves the healthy skin in between, so it allows it to heal quicker. So I do something called a fractional CO2.
Is that as invasive as...
It's not.
It's not.
It's not as invasive, so you can't expect to get as dramatic a change. But the good news is that you're talking 3 to 5 days, maybe 5 to 7, as opposed to 7 to 10 or 10 to 2 weeks. And then with a full bore CO2, besides the 2 weeks of healing, you have redness that can last for months.
And hypopigmentation.
Hypopigmentation, hyperpigmentation, that's exactly right.
Yeah.
So you have to be careful with that, and we tend to do fractional CO2 if we are
Which
going
is
to
Fraxel?
do CO2.
Is Fraxel who...
Fraxel is similar to fractional CO2, that's exactly
Yeah.
right, yes.
It's nice to know that there are a lot of different options besides being bedridden or in your house hiding.
That's
and
correct.
that
And it
you're not
really
gonna
is
have
just tailored to the patient's needs. And a patient, everyone wants a quick fix. I mean, that's reality. Paint
Which is
my
why fat
face.
fillers are so great.
Yeah, paint my face and make it go away. And the truth is, okay, if you can be down for 2 weeks, we'll do that. If you really need to be down for only a day or two, you really need a series of that. And
Right.
then gradually it builds up, and the collagen induction takes a while. So
Yeah.
the changes are cumulative over time.
If you are doing a more invasive procedure like the CO2, how do you know that you don't go too far and take too much dermis?
Very good question. It's done by, when I do my med spa esthetician does, she goes down a couple of millimeters of microneedling, erbium, Fraxel. If it's a full bore or a deeper CO2, then I do it myself. I do it under great visualization, and you have to test the skin as you're doing it to try to make sure that you're at the right level. Yes, because if you go too deep, besides the pigmentary changes, you can develop actually scarring. You can develop something called hypertrophic scarring, and that's definitely one of the risks. So it's, risk reward. You have to balance that.
So you have to
Yeah.
be a very skilled, knowledgeable person to know what you're doing and be
Yes.
patient.
That's correct. And your patient has to be patient.
Yeah.
Because they, want that immediate result. So, yeah.
So that's going to take, these are things that are going to take a longer time to get the results.
That's
but,
correct.
But they're safer.
That's correct. That's correct.
And
yes.
time-wise, they really work. What
Yeah.
about PRP? You mentioned it earlier, and it is the catchphrase that everybody's using. And what is the
What's
effectiveness?
it all about?
Yeah,
Okay.
what's it about and how effective is it?
PRP, or platelet-rich plasma, is essentially a growth factor, or using growth factors for therapy. So this goes, there's a whole gamut of stem cell therapy. All kinds of things you hear, like orthopedic surgeons using it to inject joints,
Yeah.
and this and that, and growing organs. So, there's a whole, it really has not reached its full potential at all, but there's a lot of hype out there.
Yeah.
You hear like the vampire lift and things like
Yeah.
this. What definitely has been proven is that you take platelet-rich plasma, which has growth factors from your skin, from your blood, it will speed up the healing of a microneedling and end up with a better result. There are indications to inject it as well, to inject it for hair growth, or to inject it, yes, or to inject it to supplement fillers. So it doesn't give you as much volume as a filler, but it might help to supplement your filler injection, so maybe it lasts a little bit longer or looks a little better. But just to inject platelet-rich plasma just as a filler, I'm not convinced that that's any better or any longer lasting than a filler by itself. But it can be a good supplement or good adjunct to that.
Do you do the PRP for hair loss?
We do. We do it occasionally. We don't have a huge hair loss practice, but we have some patients that I don't do hair transplant. I don't have a huge hair loss practice, but we do have some patients, mostly women, that have some thinning of their hair. And so if we do the PRP, then we can inject into those areas, and it helps to spead up the healing.
That's great.
Yeah.
What other kind of products do you have that people should be
using? Okay, so we do have a full line of products labeled with our label. And
so you have your own?
Yes, we have our own label, and there are products for there's something called Polish Me, which is great. It's got some little particles to help clean the skin.
Like exfoliant?
Exfoliant, yes. Yeah. Oh, thank you. Retinoids. And then we have, for bleaching, kojic acid, vitamin C, just some great products.
So the bleaching for people who are hyperpigmenting?
For the potential for hyperpigmentation. So hydroquinone is the prescription medication. What we use is something called kojic acid. So kojic acid is sort of a natural hypopigmenter for people that tend to hyperpigment. And of course, hyperpigmentation, for any of these treatments we're talking about with the skin, the deeper you go and the higher what's called a Fitzpatrick, there's a scale of 1 through 6. So patients that tend to be a 4 or 5, which is generally, of course, if you're black, Spanish, Asian, with a higher, less tendency to burn, but you have a higher tendency to burn from the sun because you do have some protection of melanin, but you have that thing called post-inflammatory. You can have post-inflammatory hyperpigmentation, which can be quite problematic when you wound the skin a little bit trying to get an improvement, and then all of a sudden you get the hyperpigmentation. So we're very careful to make sure to pre-treat those patients and then treat them afterwards to make sure to minimize that.
Which I think is wise.
Yeah.
And then, of course, the patient has to also follow your instructions and not be in the sun after they've had...
It's hard to do in Florida, but...
Right. So do you also have a good sunscreen that you recommend?
We have an amazing sunblock, yes. And I definitely recommend a sunblock, usually titanium dioxide or zinc oxide as opposed to screens, and it should be at least 30 or 50, and apply it enough. And I know I'm guilty. I don't always apply it.
I put it on every day now that I'm in Florida.
No, it's really important because it's not just when you go to the beach or go play golf, just walk in the street or drive in your car. Absolutely.
Because you want to live in Florida and not look like you live in Florida.
Well, hopefully not. I mean, but there's still plenty of people that are out there baking on the beach. You see that. And just with very leathery and brown skin. It used to be considered attractive, but it doesn't get attractive when you get older. It's, you got to be careful with that. Not to mention skin cancer.
Which is, it seems like there's a higher incidence.
Absolutely.
Our ozone layers thinning, higher risk.
Absolutely.
The last show we talked about massive weight loss and what happens to the skin, literally the entire body, if you've lost a massive amount of weight. What can you do for those folks?
Okay, well, it's a long story, but essentially we were talking about this, that it could start from the neck, go to the arms, go to the breasts, go to the abdomen, go to the thighs, and everyone kind of carries their weight differently depending on how heavy they were, their age and all that. And so we have to sit down and say, look, this is what we can do at once. We can do your breasts and we can do your arms. Or we can do a facelift and maybe do something with your arms. Or we could do your thighs and maybe your trunk. So the trunk can be something called an extended abdominoplasty, where it's essentially just a tummy tuck would be for a typical weight pregnancy woman. But if someone loses a massive amount of weight, then they have problems that go all the way around the back. So then it's something that's circumferential, so-called lower body lift. And then sometimes it's necessary to actually make an incision up and down because the skin inflates and deflates in this direction, down vertically, and then also horizontally. And if you don't bring it in this way, you may not get as tight an appearance. So these are big surgeries, and I always like to say that...
Are they big scars as well?
Well, big scars. So I always like to say that many patients that have had massive weight loss, whether they lose it on their own or where they have a bariatric procedure, the bariatric procedure involves tiny little incisions, usually laparoscopic, dramatic 100-pound weight loss, and then we have to make big incisions.
Yeah.
We try to hide them in areas that are well concealed, and of course spend a lot of time suturing to make the
Yeah.
scars look as good as possible.
And let me ask you this: if the person knows they're going to be losing a rapid amount of weight and they're not where they're at, but where they're ready to have a procedure with you, do you recommend that they wear compression garments during that weight loss?
That is the Del Walmsley.
Keep going.
Yeah, compression garments are definitely very helpful to try to minimize the loss of elasticity, but there's an intrinsic elasticity that may or may not benefit by it. But I don't think there's a problem with trying to use compression, and we definitely use it after surgery. Yeah.
Well, thanks so much for coming tonight. And I know you also do mommy makeovers, so hopefully one night we could have a show where you
Next
talk
time.
about the mommy makeovers.
That'd be great. Okay.
Well, we hope you've enjoyed tonight's show, and happy Monday to everyone. And we're going to a commercial break now.
Thanks for listening to the Ask the Expert Show, featuring interviews with local experts in the fields of legal, health, financial, and home improvement. Call our office at 888-574-6999 to become one of our experts on the show. And tune in again next week for more Ask the Experts with Steve-O.